After a cardiovascular accident, the necessary resumption of physical activity. Our health advice: after a first cardiovascular accident, physical activity is crucial to reduce the risk of recurrence. But getting back to it isn't always easy. With nearly 120,000 myocardial infarctions and 150,000 strokes each year in France, cardiovascular accidents are very common. While many people survive, these survivors need to be extra careful about their lifestyle. Indeed, more than 20% of them will have a recurrence within 5 years of the first accident, as several studies have estimated. In this context, resuming a sporting activity appears to be one of the best means of preventing a new accident. Sport, a magic remedy. Physical activity reduces all the risk factors for the recurrence of a cardiovascular accident: blood pressure, cholesterol level, diabetes, tobacco, alcohol and obesity, explains Dr Laurent Uzan, sports cardiologist and author of Take Control of Your Heart Health. Leduc. Sport is not a magic remedy, but almost. Not to mention intensive sports training, the resumption of physical activity allows a 30% reduction in the risk of having a second cardiovascular accident, continues the doctor. However, few patients follow these recommendations. You will never see a patient start a physical activity on their own after a cardiovascular accident. It's too hard and scary, notes Dr Leduc, cardiologist at the Cardiac Rehabilitation Platform at St. Joseph Hospital in Paris. Returning to sport is indeed easier said than done, especially since you should not go about it anyhow or anytime. You shouldn't start again too early. There is a risk of decompensating, that is to say having another accident, says Dr Uzan. At a minimum, you have to do a stress test, which is part of the cardiac rehabilitation program. This allows you to know at what level you can resume sport and up to what heart rate you can push your heart without dying. Overcome fee. Following a cardiac rehabilitation program is a valuable aid in resuming physical activity in good condition. This personalized program, supervised by a cardiologist, is very frankly beneficial. It would reduce the risk of recurrence by nearly 25%, according to Dr Uzan. However, only 30% of patients follow programs of this type after a first cardiovascular accident, laments Dr Leduc. They are generally scared of the idea of it happening again, so they no longer dare to play sports. On the other hand, among those who enter a cardiac rehabilitation program, more than half will continue to have a physical activity, continues the cardiologist. Fully reimbursed by Social Security to people who have had a first cardiovascular accident, cardiac rehabilitation can be carried out on an outpatient basis, that is to say during the day at the rate of 3 to 5 sessions per week for 1 or 2 months. The program can also be followed during hospitalization for 2 to 3 weeks. The sessions are structured around physical activity, especially the treadmill, the rowing machine, the bike and gymnastic. At the same time, cardiologists and dietitians provide advice on diet and the management of physical effort. Once the program is completed, the patient is free to fly on their own. There is no limit to physical activity. The patient knows what he can do and can therefore join any club or gym, says Dr. What activities against sedentary lifestyle? Once the program is finished, any type of physical activity is strongly encouraged in order to limit sedentary lifestyle. In particular, we generally recommend that a heart patient practice a low to moderate intensity endurance sport for 20 to 30 minutes a day 1 to 3 times a week, indicates the French Federation of Cardiology. These activities can also be practiced by people with a pacemaker. Swimming and cycling, for example, are excellent options for gently working your heart, while avoiding shocks to the joints in the event of overweight. Another option, walking, which allows you to combine physical activity and family walk. Services. Find our advice for choosing the right posture corrector in our buying guide.